Gun violence is a public health issue because it is at its core a health problem. It's about injury to the body of the person who's shot and to the community around them. And the public health approach provides a different path forwards when we're talking about reducing that injury. Because it's a really standard framework that we use for every type of injury or illness in the world. 4 basic steps. The first is you gather data on how common a problem is. The next is you look at who's at greater risk than others or who might be protected, all other things being equal. The third step is you develop and evaluate interventions that could make a difference. Those interventions for gun violence could range from early childhood education through programs for kids who are in the hospital who have been in fights or have already been shot, through changes to the environment in which people live, greening of vacant lots, putting in streetlights, programs like that. In that third step of the public health approach, we don't just say, oh, this intervention might work to reduce risk or improve protection, but we also study it to prove that it makes a difference and to prove that it makes a difference for the people who are highest risk. And then the final step in the 4-step public health approach is that we scale what works, and then we go back to the beginning again and measure and keep trying to improve. And when we apply that 4-step approach, we've succeeded over and over again throughout history. We've succeeded in reducing car crash deaths, not by taking cars off the road, but by putting in place seatbelts and drunk driving laws. And heck, ride shares make a big difference in the number of car deaths. We've used the 4-step approach, of course, for HIV and AIDS. We've discovered the virus, we've figured out who's at risk, and then we've put harm reduction programs in place. Abstinence only doesn't work, so we've thought about other ways to help reduce risk of infection and of progression of HIV to AIDS and to death. We haven't really applied it systematically to firearm injury, partly because there wasn't funding from the federal government to apply that 4-step approach for so long, but partly also because very few people conceptualize of it as a health problem rather than as a political or crime problem.